Please remain standing for the singing of the national anthem. Tonight's anthem will be performed by Ann Gredis.
Oh, say, can you see by the dawn's early light?
I have been singing since my third grade year. I was in a musical and started singing. I was inspired by my mother. She's a wonderful singer.
When troubles come and my heart burden be.
I noticed a huge change in June of this summer, and I had sang in a couple of weddings, and then I noticed that I got sick with a bad cold and I started to cough a lot, and I basically lost my voice and it didn't come back. So I went to my ENT. He did a scope and did an exam and felt that it was serious enough that I needed to see a specialist. And what he had told me is that there was something peculiar on my vocal cords that was very similar to the famous singer Adele. And I knew enough about Adele that she had had surgery.
My first impression of Ann actually started before I went into the room. One of the nurses who was involved in actually rooming her said, "Oh my gosh, this singer has been at every major event in our family."
And she knew that my voice was important. I had sung in her son's funeral, and that was one of the comments that Dr. Dowdle had said, your voice is between your head and your heart, and how you use your voice is so important.
She really viewed singing as an act of service, to be able to be there with families when they're going through their life events.
When I first met her, the first thing that she did is she explained that she knew what I was going through because she was a singer herself.
There are common things that happen to singers that cause voice change, medication side effects, swelling of the vocal folds, even some bruising or blood blistering. This particular patient had a combination of factors, as is really common with singers, and so to be able to move through all of those things to really reclaim the voice and vocal function.
I really wanted to sing in this wedding in October, and I knew I trusted her. I knew that she was going to get me to that point. So it was just, okay, we're in the middle, first part of July. We have a few months. You're going to get there. She told me it was going to be a long recovery. When someone tells you you might not be able to sing again, and it's something that I do for a living, but it's really what I do to give to others. And this wedding in October was one that I really wanted to be there for, and thankfully I was.
Blessed is he who comes in the name of the Lord.
One of the things that's really crucial about taking care of singers is that they're going to need to get in and they're going to have questions, and that responsiveness, it's really important to me to be able to be of service, not only in the diagnostic place, the treatment place, but the accessibility place.
I sing her praises, and she's the person who really gave me hope, along with her speech therapist and her nurse as well, because they're such a team.
More than I can